Which of the following metabolic changes is most likely to occur in prolonged fasting? A. Increased glycogen synthesis. B. Decreased ketone production. C. Increased gluconeogenesis from amino acids. D. Increased insulin secretion. Answer, C. During prolonged fasting, glycogen stores are depleted, and the body begins producing glucose through gluconeogenesis using amino acids from muscle breakdown. Ketone bodies are also produced for energy, but insulin levels remain low. What is the primary function of albumin in nutritional assessment? A. Indicator of short-term protein status. B. Indicator of long-term protein status. C. Reflects iron levels. D. Reflects hydration only. Answer, B. Albumin reflects long-term protein status because of its long half-life, approximately 21 days. It is used to assess chronic malnutrition rather than acute changes. Which dietary pattern has the strongest evidence for reducing cardiovascular disease risk? A. Paleo diet. B. Ketogenic diet. C. Mediterranean diet. D. High-protein diet. Answer, C. The Mediterranean diet, rich in fruits, vegetables, whole grains, olive oil, and fish, consistently shows benefits for cardiovascular health due to its anti-inflammatory and lipid-lowering effects. In a diabetic patient, which carbohydrate counting strategy provides the best glycemic control? A. Fixed meal plan. B. Matching insulin dose to carbohydrate intake. C. Avoiding all carbohydrates. D. Eating at random times. Answer, B. Matching insulin dose to carbohydrate intake offers individualized control and helps maintain blood glucose within target ranges. Which vitamin deficiency is most associated with prolonged use of proton pump inhibitors, PPIs? A. Vitamin A. B. Vitamin D. C. Vitamin C. D. Vitamin B12. Answer, D. PPIs reduce stomach acid, which is essential for vitamin B12 absorption from food, leading to potential deficiency over long-term use. When counseling a patient with renal failure, which nutrient should be most closely restricted? A. Fat. B. Phosphorus. C. Carbohydrate. D. Vitamin K. Answer, B. Elevated phosphorus levels can lead to bone disease and renal failure, thus, foods high in phosphorus, like dairy and processed meats, are limited. What is the primary nutritional goal for a patient with COPD, chronic obstructive pulmonary disease? A. Increase carbohydrate intake. B. Reduce fat intake. C. Minimize CO2 production by lowering carbohydrates. D. Avoid all proteins. Answer, C. High carbohydrate intake increases CO2 production during metabolism, which can worsen breathing difficulty in COPD patients. The Harris-Benedict equation is primarily used to calculate A. Daily protein requirements. B. Resting energy expenditure, RE. C. Water needs. D. Electrolyte balance. Answer, B. The Harris-Benedict equation estimates resting energy expenditure based on age, sex, weight, and height, helping determine total energy needs. A patient presents with spoon-shaped nails and fatigue. Which deficiency is most likely? A. Zinc. B. Iron. C. Folate. D. Copper. Answer, B. Spoon-shaped nails, cholonychia, are a classic sign of iron deficiency anemia, commonly due to chronic blood loss or poor dietary intake. Which mineral is essential for insulin function and glucose metabolism? A. Calcium. B. Zinc. C. Chromium. D. Sodium. Answer, C. Chromium enhances insulin sensitivity and is vital for normal glucose metabolism. Deficiency can impair glucose tolerance. What is the best dietary recommendation for a patient with celiac disease? A. Avoid lactose. B. Avoid gluten-containing grains. C. Reduce fat intake. D. Increase protein only. Answer, B. Celiac patients must eliminate all gluten-containing grains, wheat, barley, rye, to prevent intestinal damage and malabsorption. Which nutrient enhances non-heme iron absorption when consumed together? A. Calcium. B. Fiber. C. Zinc. D. Vitamin C. Answer, D. Vitamin C improves absorption of non-heme iron by converting it to a more absorbable form in the gut. In tube feeding, the most common complication associated with improper positioning is A. Constipation. B. Aspiration pneumonia. C. Hypoglycemia. D. Hyperkalemia. Answer, B. If a patient is not positioned properly, head elevated 30 to 45 degrees, formula can enter the lungs, leading to aspiration pneumonia. A 60-year-old male with type 2 diabetes should aim for what HbA1c target under ADA guidelines? A. Less than 5%. B. Less than 6.5%. C. Less than 7%. D. Less than 8%. Answer, C. The ADA recommends a general HbA1c goal of less than 7% for most non-pregnant adults to reduce diabetes-related complications. What is the best intervention for a client with pressure ulcers to promote healing? A. Increase protein intake. B. Reduce fluid intake. C. Restrict fat. D. Limit calories. Answer, A. Protein supports tissue repair and immune function. High-protein diets help speed recovery in patients with pressure ulcers. Which fatty acid is considered essential because the body cannot synthesize it? A. Palmitic acid. B. Stearic acid. C. Linoleic acid. D. Oleic acid. Answer, C. Linoleic acid, omega-6, and alpha-linolenic acid, omega-3, are essential fatty acids that must come from the diet. Which vitamin is primarily involved in blood clotting? A. Vitamin A. B. Vitamin D. C. Vitamin E. D. Vitamin K. Answer, D. Vitamin K is essential for synthesizing clotting factors in the liver. Deficiency can lead to bleeding disorders. The DASH diet is most beneficial for individuals with A. Hypoglycemia. B. Hypertension. C. Anemia. D. Celiac disease. Answer, B. The DASH diet, dietary approaches to stop hypertension, emphasizes fruits, vegetables, and low-fat dairy to reduce blood pressure. What is the most appropriate initial nutrition intervention for severe obesity? A. Immediate surgery. B. Balanced calorie-restricted diet with exercise. C. Fasting. D. High-protein supplements only. Answer, B. A moderate calorie deficit combined with physical activity and behavioral modification is the safest and most sustainable first-line approach. Which of the following increases nitrogen loss from the body? A. Low carbohydrate intake. B. Excess protein intake. C. Fever and trauma. D. Vitamin supplementation. Answer, C. Stress, fever, and trauma increase protein catabolism, leading to higher nitrogen loss and muscle breakdown. What is the recommended weight gain for a woman with a normal BMI during pregnancy? A. 25 to 35 pounds. B. 11 to 20 pounds. C. 5 to 10 pounds. D. 40 to 50 pounds. Answer, A. For women with a normal BMI, the Institute of Medicine recommends a total weight gain of 25 to 35 pounds to support healthy fetal growth. What is the main purpose of the Nutrition Care Process, NCP? A. To collect lab data only. B. To guide medical diagnoses. C. To provide a standardized method for dietetic practice. D. To assess calories only. Answer, C. The NCP ensures consistency and quality in nutrition care through steps like assessment, diagnosis, intervention, and monitoring. Which food is the richest source of preformed vitamin A? A. Liver. B. Spinach. C. Carrots. D. Sweet potatoes. Answer, A. Liver provides preformed vitamin A, retinol, which is more bioavailable than provitamin A carotenoids from plant sources. In parenteral nutrition, which component provides the highest calorie density per gram? A. Carbohydrate. B. Protein. C. Fat emulsion. D. Electrolytes. Answer, C. Fat emulsions provide 9 kilocalories per g, the highest among macronutrients, making them valuable for energy-dense nutrition support. What is the earliest sign of dehydration in adults? A. Rapid heart rate. B. Dry mucous membranes. C. Confusion. D. Low blood pressure. Answer, B. Early dehydration is indicated by dryness in the mouth and mucous membranes before more severe systemic signs appear.